Sheffield Health Centre, can I help?
It's about quality of life for me.
Yes.
And my life is not a quality life.
No.
It's like being in a prison.
What are you worried it might be?
Skin cancer.
What actually happened?
I'm a boxer.
Right.
And I got caught with a shot.
I fell onto my head.
Right.
I was paralysed neck down. My ankle went up. I heard it crunch and pop and...
We need you in the NHS for a long, 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 long time. So we need to look after you.
Health Centre, can I help you?
Georgie.
Oh, where's this doctor?
Hi.
Hello.
Come on in. Have a seat. So what's been going on?
She's been getting a lot of nosebleeds, but coming from just this side of the nose, but she's getting a lot of them in school.
Oh, right.
The first aider said to me today it's going on bleeding for at least 5 to 10 minutes.
OK. How often are they coming then?
She could at least have 3 or 4 a week.
Right. And how long's that been for?
Like the last 2-3 months.
OK.
One week when we was in school, she had quite a big one, they couldn't stop it.
Right.
And she said to me, well, if I was you, get her checked, because she could have a blood vessel or something like that.
Yeah, well, it's definitely a burst blood vessel, because that's what's causing all of the bleeding. Should we have a little look and see what's going on? But there's nothing, you're not feeling unwell with it or anything like that? No.
Hello.
Hi.
Have a seat.
Thanks.
Right, what can I do for Hugo?
His eyes, I've been a few times.
Right.
And I've been to see the health visitor as well.
Yeah.
And I'm getting a lot of conflicting messages.
Right.
Every time I come here, the GP's told me that it's kind of normal for his eyes to be this sticky.
Yeah.
The health visitor told me it's not, it's definitely an infection.
Right.
And it's just when he's waking up from nap.
Yeah.
And in the morning, he can't open his eyes.
So have we tried any antibiotic drops?
No.
No. I think that's what we need to do.
Yeah, okay.
So the thing I think that we're probably not passing on to you is that he's got conjunctivitis, it's obvious, isn't it? And it's a bacterial conjunctivitis.
Yeah, because this, I cleaned it before we left the house about 10 minutes ago.
I think the thing is, often it clears up on its own over a few days with just wiping it. But if it hasn't, then you need antibiotics. How long's it been there for?
5 months, probably.
And we haven't used antibiotics?
Once when he was about 2 weeks old.
Right, OK. So let's try them again.
Yeah,
OK, if it doesn't settle, then come back and see us, OK?
I've just been feeling so frustrated every time I come. I'm just like, my baby's got sore eyes and it's just like, I'm having to open his eyes up for him every time he has a nap.
Oh, bless him. Yep, so 4 times a day. OK, be careful to wash your hands and everything because it is quite infectious. Give it a week, 10 days. If it's not clearing up, come back.
Yeah,
OK?
Oh, thank you. Hugo, sort your eyes out. You'll be able to see again.
OK.
Thank you so much.
No problem. Pizzaurus Rec, eh? That's fantastic. OK.
Thanks.
Bye-bye, sweetheart. He's gorgeous.
Just look up for me. Oh, yeah. Is it itchy?
No.
And this one's OK?
Yeah, that one's fine.
Yeah. And this is the only place that you're bleeding? You don't get any bleeding anywhere else?
No, nothing.
No other bruises to see or anything else?
No.
Because it's really common to get nosebleeds. And what I can see up your nose is that there's a little area, which is the place that you get nosebleeds from, that's got a little bit of a crust over it, and that's where your nose is bleeding from. And mostly, if we give you some cream, that will settle it down, because often what happens is you get a bit of an infection there, and it stops the nose blood vessel from healing up very well, and that's why it keeps bleeding, all right? And it's not a serious medical problem, it's just that you've got nosebleeds. And as long as you're not feeling really dreadful and unwell, then that's all that we need to do. The most important message is to learn how to stop them. because there should never be a kind of nosebleed that you want to, you don't want that to carry on for you.
She panics, and of course she was panicking and made me panic.
And that's part of the problem often.
Yeah.
So you need to learn how to stop them on your own, OK? And the way to stop them is to get your finger and thumb like this. You put your nose right in the middle and grip really tight. Now, often people say grip here.
Nose.
Means no difference, because that's just bone up there and hard cartilage, so you can't do anything there. And sometimes people say, put your head back. Don't do that either, because then the blood all just runs down the back. You need to hold it like this, but really grip tight, and then you need to hold it for 10 full minutes. And then 99% of the time, that will have stopped all the bleeding. And obviously, if it carries on after that, then try it again. But if it doesn't stop after that, then you need to go and see somebody, because then it's really not stopping. But the major problem is that you don't press for long enough.
Press for long enough.
All right. And then if this isn't working, then we'll see you again, just to follow it up. All right? Cheers, then.
Lovely, thank you.
Bye.
Bye.
Firstly, how are you?
Terrible for the last couple of days, to be honest.
Right, what's been happening?
Feel tight around the chest all the time. Slightest exertion, I'm breathless. But I keep going and it sort of diminishes a bit and I can get over it. And then sleeping, lie down, I feel as though I'm suffocating. I sort of get a panic attack, start breathing again, and I found it better last couple of nights, basically sitting up, trying to sleep.
Right. Over what period of time do you think this has happened?
This last bit now is about 3 or 4 days, isn't it?
Yeah, it's over the really hot weather and his feet are very swollen.
Yeah, they've never been like that before.
No, so this has happened over the last 3-4 days.
Yeah.
Your ankles have swollen up, but more importantly, you're getting more short of breath when you do something.
Yeah, it might be coincidence. It seems since I've been taking the beta blockers that it sort of pronounced it more, if you like.
But you're getting chest tightness, are you?
Feels like I've been sort of squashed a bit.
And that's for how long?
Only seconds.
And how do you think Alan's been?
Constantly sleeping. If he sits on a flat surface, he's asleep. And he does this regularly.
Okay.
And I can be talking to him like I am you. We're having a conversation, he just closes his eyes. And then wakes up 3 or 4 minutes later, has no recollection of the conversation we've had, which was symptomatic of last time before he had his heart operation. Actually, he used to do that quite regularly.
Still really painful, actually. So it's all of this bone here.
Now I feel pain everywhere.
Lower down.
In my leg.
Okay.
I've sort of landed with a straight leg and it's bent sort of the wrong way.
Arms up.
Ow, there.
It's really limited, isn't
yeah,
it?
it is.
Hi.
Hi.
What's been going on?
I fell down a rabbit hole.
Oh, dear, right.
My ankle went up. I heard it crunch and pop and...
Right.
So I've just been getting on with it, but it's not getting better and it, I can't bend it. You know, like when you sit on your foot,
Yeah.
I can't do any of that.
OK.
So I think there is some...
And were you able to walk on it at the time?
Oh, well, it was a struggle getting home.
Yeah.
But yeah, I've just sort of like pushed
Just kind of
through
got
it.
on through. And what have you been using for it?
Nothing.
This was which day?
About 7 weeks ago.
7 weeks ago?
Yeah.
So what's brought you up tonight, then?
Well, it's just not getting better.
Yeah.
I am going on holiday on Tuesday.
OK.
So I just wanted to check before I went.
Yeah, because I think, if you did sprain your ankle,
Yeah.
which is what probably has happened, then it does often take months to get better.
Yeah.
Is it sore at all?
Yeah,
Not-
it's more here.
Not round the back, though.
No.
Move it round and round.
It's there.
This is where it's sore, yeah.
Yeah.
That's where it's painful. Because that's the classic spot where you get a sprained ankle.
Ah, I
Is
can't
it
do
sore
that.
on your foot itself?
No, it's there. I'm going to bend it.
What about in here?
Yeah. I'm trying not to cry.
But it's more in here rather than in there?
Yeah.
It's more in over the foot?
It's all of it.
I mean, I think most likely this is just a nasty sprain that you've got. It can put people on crutches, so just because it's a sprain doesn't mean it's not serious.
Yeah.
And it does mean that it can go on for months. It can be worse than a break because actually the ligaments heal up less quickly. Because it's actually more over the foot, though, I think it is reasonable to get an X-ray.
Yeah.
I will arrange that for you to go up and just go and have that.
Drop in.
Yeah. Do you want some painkillers?
I've got painkillers.
You've got some?
Yeah. Is that just any day?
Yeah, 9 till 5, Monday to Friday,
9 to
so you can
5.
go up tomorrow.
Lovely.
And then why don't you give it a week and then ring just to get the result?
Yes.
All right.
Thank you so much.
Cheers then. Hopefully it will just, there won't be anything there, but if there is, then we'll do something more about it.
Thank you very much.
OK, bye.
Bye.
Do you ever feel as if your heart's jumping beats?
Not really, no.
No. OK, fine. So it'd be good to have a listen to your chest and heart as well, if that's OK.
Yeah.
So we just pop onto the couch here. Nice breast with the open mouth. And out. Let's help you pop that on. Get proper service here, you see, when you come in. There we go. I think what we need to focus on is just this heart rhythm. If you don't mind, it would be good to have another ECG or heart recording now.
Yeah.
And I'm probably just going to have a word with the cardiologist because I'm wondering if we can just sort you out a bit sooner. And also another blood test. Is that all right?
Yeah.
So we're going to take a seat in the waiting room and they'll call you through into the treatment room. All
Yeah,
right,
for,
we'll
for
sort you out.
months and years, don't come here, and then suddenly...
It will be 5 minutes. That can happen. That's
Yeah.
all right, we'll get through.
OK.
Come on through. Thank you. Once you've had the recording, if you still take a seat back,
Yeah.
and I'll talk to you at the end, OK?
OK, yeah.
Lee Haskins, please. Have a seat.
Thank you.
Right, what can I do for you?
What it was, I got whiplash down my neck the
Right.
other, on Saturday.
Yep.
But it's done something to my arm and it's like on numb.
Right.
And I can't lift it to a certain level and it feels really weak. There's nothing there.
What actually happened?
I'm a boxer.
Right.
And I got caught with a shot. I can't remember if it was on maybe my face or something, but it's like whiplash my neck.
Different people have different terms for things, OK?
Yeah, of course.
So what do you understand by whiplash?
I just like put my neck, burn the sensation down my neck.
Right, OK.
I kind of can't twist it. You know?
Can't twist it, OK. Well, how did you feel immediately afterwards?
I felt fine in myself,
Yeah.
just the burning sensation down my neck. I didn't even
Yeah.
know there was something wrong with my arm until I got up and then I tried to kind of throw something back and then it was numb.
Have you taken any painkillers for it?
No, I took nothing, no.
No, any particular reason?
Just thought I wouldn't.
Just your hard.
Yeah.
OK, fine. And have you had any injuries on your neck? Bad injuries before?
No, nothing before, no.
No, OK. And I can see bruising around there. Is that from
Yeah,
the
it's from the
boxing?
fight, yeah.
OK. Was it a good fight? Did you win?
I lost, but it was good. It was a very close fight, but this happened early in the fight, so if it didn't happen, I would have probably won the fight.
Absolutely.
Yeah, so
right, OK.
we're looking at
Let's have a
rematch.
little look. Right, if you slip your hat
sorry.
off, what I'm going to do is just see your neck movements, if that's all right. So move your head right back. Yeah.
Yep.
Chin onto your chest.
I feel that.
So you feel like, as in pain?
Yeah, a little bit of pain right there.
I've got a 65-year-old chap who's come in with basically symptomatic with chest tightness for the last 3-4 days, which radiates to his jaw and neck area. He's feeling more tired, a bit more breathless when he does anything and when lying flat. And his ECG today, it's clearly keeps varying. It's 154 at the moment. Yeah, he's here in the GP surgery over at Hallfield, so I'll get an ambulance to transfer him over. Yeah, lovely. Thanks very much. Cheers. Bye-bye.
How have things been since we spoke on the phone?
Finally, my headache receded on Saturday.
Good.
But even just moving my head, everything felt totally bruised inside. And this swelling that I've been getting for years now is beyond a joke.
Yeah.
When I got up first thing in that morning, my head was like a football, when normally it swells from here. My whole face, I was so shocked when I looked in the mirror, it wasn't like me at all.
Tell me what things you think have been ruled out with it.
They ruled out, well, they were concerned about meningitis and possibly a hemorrhage, you know, in the head.
But I think the headache has resolved now, so really it's the swelling issue that's the problem that you want to...
I've never had a headache like that in my life, ever. And I feel very, very unwell. I'm at the end of my...
Yeah. So I I confess that I don't know what it's caused by, and we have discussed it a number of times before. And I know that you've discussed it with specialists as well, and in particular the specialists that know you best, which is the rheumatologist, because of both of your rheumatological problems. And so I don't know what would be next, to be honest, and I am aware that sometimes when that's the story, very occasionally I've missed something, and so have all the other doctors, and there is something that can be sorted out, but quite often we just don't know, and we never will know, and...
It's making my life absolutely miserable.
Yes.
On top of fibromyalgia and arthritis and everything, every other condition.
Yeah. Then there's kind of just trying to manage the problem,
That's what I've been trying to do that for years. I mean, that's why I've come to a point now where I've tried everything I can think of, but I'm nowhere further along the line, except I'm actually worse with it.
Yeah. So the other thing that we have done is you take a water tablet.
Yes, every other day. Yeah.
Do you think on those days you're any better?
I actually think if I had them daily, I probably wouldn't have the problem of constantly going the entire wipe that day out. I think that my body would balance better.
Well, I would be happy for you to try that out as a sort of trial of treatment, really.
Yeah, that's fine.
And
I don't want to stay on it if it doesn't work.
Because my feeling is that apart from moving your drugs around a bit to try and improve the problem, what I would like to be able to do is to try and make things easier for you.
Yes.
And that is, I think, our best option. How does that sound?
Yeah, that sounds sensible. There's one thing I wanted to ask you today.
Yeah.
I've been thinking about this for the last couple of years.
Yeah.
You know, I'm willing to take my medications and do whatever I can to make my life better.
Yeah.
However, I do not want to be resuscitated if anything should happen.
Right.
So could that be put on my notes?
Yes. So...
I've spoken to my children about it.
OK. So that's an interesting question. So normally we would have that kind of discussion if somebody had a life-threatening condition or they were very frail, which you don't really have either of those things. So you are neither very frail nor have a life-threatening condition.
I certainly don't look frail, but...
no, I think, you really don't look frail. We have a form that we fill in for that kind of thing. Where we write down that we've discussed it with you, that you have agreed that's what you want. And then, so what we do is we then use that form and send that off to the ambulance service so that they know not to resuscitate you, otherwise somebody will call and you will be resuscitated.
That's right.
And that form needs to be with you, so it stays in your home.
But it's about quality of life for me. And my life is not a quality life.
No.
It's like being in a prison.
Yeah, well, it's very difficult. The request for DNR, do not resuscitate, was unexpected. There are protocols that we go through to make sure that we're making the right decision, that the patient is able to make the decision, and if not, we would convene a best interest meeting. And I think that Julie Dawn is able to make that decision herself. But in this particular case, I decided I would have a think about it myself and also talk to some colleagues. Just going back to the water tablet thing, you only get 28 tablets at a time.
Yes,
Shall I change that so that you can be on them daily?
Yes.
Yeah? And put that on repeat. All right, well, let's hope that you're right about the water tablets.
Yeah, I hope so. It would be lovely to have a simple answer, wouldn't it?
OK.
Yeah, can but try.
Yes.
All right, thanks very much. Yeah, that'd be fine. Thanks ever so much.
That's all right. Bye now.
Bye-bye.
Hello. I've got an appointment at 10:20. I can't remember who it's with.
So it's Dr. McLaren.
That's it. I can't remember the name.
Not a problem. We can always find it. OK, take a seat then.
I got my own, thanks.
How many times do we say that? Habit.
Right, OK. Arms now. If you hold my hands, squeeze them really tight. Really tight, as tight as you can. Hurt me.
Sure.
Yep, absolutely. Okay. I'm hard. That's it. Pull me towards you. Pull me really hard. Good. Push me away.
Yeah, that's where I don't feel
that's not working, is it?
No.
No. Right, OK. Just relax. I'm just going to check your reflexes, OK? Right, OK. I'm just going to touch you with my finger, like that. OK, if we roll these back up, if that's all right. So you shut your eyes and say yes each time you feel me touch you.
Yeah. Yep. Yep. Yes. Yep.
So you can't feel there, can
No.
you?
Yeah, no, that's a bit...
So that feels different?
Yeah, this feels a lot different.
So can you show me where it feels different?
Just like down this line.
Yeah. Right. So I think you've done something that's caused a problem with the nerve going into that shoulder, down that arm, and causing the power problem. It's probably in your neck.
Yeah.
I'm a little bit concerned about that.
Is this a fairly recent tattoo? It's on the blue ink, isn't it? That it's lumpy-bumpy. If you feel there, it's not.
I think part of it is infected. It's passing sort of here and here.
Oh, nice, nice matching pair. If I get a proper tattoo, I want a big one.
OK, fine. You can pop your T-shirt back on. So I'll refer you for an urgent MRI, OK?
OK.
If things get worse, please come and see us sooner. So if the power reduces even further, the numbness spreads, the range of movement of your neck, shoulder gets worse, come sooner.
OK, brilliant.
Is that all right?
Yes, no
But you
problem.
can take painkillers.
Is there eventually, at any point, I can get, like, a letter to send to my manager?
Saying what?
Well, because we wanted to send it to the board that I had problems with my arm, so we maybe get a rematch and stuff like that.
OK. So. You'd have to request a letter, and there would be a charge for it.
Yeah, that'd be fine, yeah.
So you could do that via reception, OK?
Reception, yeah? OK, no problem, thank you.
No
Cheers,
problem.
Doc. Appreciate it.
OK, bye-bye.
Do I just get a letter?
You'll get something in the post,
yeah. OK, thank you.
All right, bye-bye.
Come on in, come and take a seat. Right, I'm Dr. Ahmed. How can I help today?
For about 3 or 4 weeks now, I've just been getting a flare-up of eczema.
Right.
And it's just not going away.
OK. And have you had eczema since you were a child?
Yeah, and it just flares up when I'm stressed and overtired.
Any reason why you're stressed at the moment?
Yeah, there's a few reasons, but they're things I'm dealing with, so it's work and stuff.
What work do you do?
I'm a ICU staff nurse.
Ah, OK.
Yeah.
How are they treating you up there?
Oh yeah, it's fine. It's just the type
pressures.
of work, yeah. You get some sad cases in and affects you more than you realise until you get home.
So do you have sort of strategies in place to switch off from when you come back from work?
I live with 10 people, so I switch off pretty easily when I get home.
There's plenty of people to talk to and things like that. I think that's the main thing, is to talk about it, because you're involved with those cases, aren't you? Do you know about Bristol Wellbeing Therapy? It's just an independent...
I've seen it on our intranet thing.
Yeah, just if you want an independent source of counselling, if you wanted it, there's some information there, and you can do the form online.
Thank you.
And sometimes they just do random workshops that you might be able to attend, and it's just an outlet, really, for the kind of work that you do. You don't smoke, your alcohol sort of intake's fine. Let's have a look at it.
So it's
just
always
that.
patchy.
Yeah.
So it's there and there. And then
Your face
there.
is all right, isn't it?
It's
Backs of
normally
the
around-
knees? Or?
No, I was hoping to give blood next week, but I don't think they're going to let me now, so...
OK. So I'm going to just do a prescription of hydromol. And at the moment, with the way the eczema is just on the arms, you don't need a strong, potent steroid, maybe just middle of the range.
Yeah.
And I'm wondering if on the same prescription, because I know it's difficult for you to get in, if I just put some 1% hydrocortisone, which is milder, then you can step down.
Yep.
Anything else I can help with?
No, that's great, thank you.
No, fine. OK, so the eczema we'll get on top of, but longer term, we need you in the NHS for a long, 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 long time.
Yeah.
So I need to look after you. OK.
Thank you very much.
That's all right.
great.
Nice to see you, Bethany.
Have a nice day.
Thanks. Take care. Bye.
Young Zhao?
Yeah. This way, James. Come on.
Hello. That's a very cool hairstyle. Look at that. That's brilliant.
Right.
Right, I'm Lizzie. I'm one of the urgent care clinicians.
Yeah.
How can I help you?
Yeah, the right hand nasal hasn't been feeling well for a couple of months so far.
Couple of months?
Yeah, at the beginning I had the cold, but the cold is, after the cold's gone.
Do you want to have a seat?
Yeah, I just, it feels like, you know, every time you have a sneeze, but recently when I lower my head or just knee down, pick up something from the ground, it's a bit sore.
Painful when you lean
painful.
forward.
Just.
Have you ever had any problems with polyps at all? With any growths inside your nose?
I constantly had a blocked nose when I was a little, and then they gave me treatment by putting some patches along my ears, but.
So since a couple of months ago when you had a cold, what is it? Just this sensation that's just never gone away?
No. It's not gone, it's getting a bit worse. It takes longer to get that feeling gone.
Let's have a feel of your sinuses. Do you have any pain when I press around here at all?
No. No.
Any pain here or here at all?
No.
No. And what about over your eyebrows?
No.
No. Okay. Right, let's just have a look up your nose. You're full of energy, aren't you?
Yeah, always. Always.
Just pop your head back for me. That might be big. Right, if you just slide down on the chair and put your head back there, let's have a look up your nostril. Right, I can't see anything obvious in there.
That's good.
I can't see any large polyps, like large growths or anything like that. I think we could try a nasal spray.
That was I'm coming for probably.
That was what you were thinking, to try something like that?
Try something like that, just to see whether it works.
If we give that a go and see if that helps.
Yeah.
If it doesn't make any difference at all, don't go in there.
No.
Let's come back around this way.
You see more stickers on that. Yeah. So,
So one spray in each nostril twice a day.
Okay.
Try that every day. If the sensation gets any worse or you get any other symptoms, come back sooner.
Lovely, thanks very much.
All right.
Thank you very much for your help. Thank you. Thank you, doctor.
Thank you.
Yeah.
Bye.
Bye.
Paul Michelle, please. Paul Michelle. Oh, there you are. Hello. Hi, you come along.
Okay.
It says lumps on head on the screen, is that right?
Yes.
Okay, tell me about the lumps on your head.
Well, I think I probably have mentioned them in the past.
Okay.
But it just seems to me they're getting bigger. And three independent witnesses have told me they're getting bigger.
Okay.
I can't tell.
Yeah.
And they're a bit flaky.
Yeah.
They frighten the grandchildren.
Oh, right, okay.
And I suppose I'd like you to wave a magic wand and make them go away, but failing that, some reassurance, I think.
Yeah. What are you worried it might be?
Well, skin cancer.
OK, let's have a look at that. So do you think this is enlarged?
Well, I'm not the best person to ask because I can't see. But, you know, for example, my dentist that I've been going to for years, you can get back, flat in the dentist chair, and he said, they're getting bigger, you know. And then my barber said, they're getting bigger, you know.
Yeah. But this one isn't in the way of the hair, is it? He says unkindly.
Sorry, this was what?
I said this one's not in the way of any hair.
Well, no, I mean, that's increasingly the case.
I can't speak, can I? This one here, I feel confident is something called a seborrheic wart.
That's caused by a virus, is that?
No, I don't know what causes it, to be honest.
Oh,
It's not caused by a virus. It's the one thing that isn't caused by a virus. I'm not sure what you would call that. It doesn't have any malignant features. Okay.
Right.
So these two dramatic things that scare the grandchildren. Yeah. Okay. I think they're both benign.
Yeah.
I'm 99% sure they're both benign. I think probably we shouldn't be doing anything with them, but let's get some pictures taken of them and just get their reassurance on that. Is that all right?
Well, as I say, I think reassurance would be
And if the dermatologist
something.
is unhappy with them, we'll get someone to take a biopsy or to even to remove them.
Yeah, OK.
Yeah. The pictures thing gets sent off to the dermatologist. The dermatologist usually responds very quickly once it's been... So you might wait a bit for the appointment to have the pictures done, but normally within, well, 3 days, we've got a reply back saying this is what you need to do about it.
Yeah. Well, OK, that's fine.
Is that all right?
Yeah.
So you could wear a hat, I suppose, not to scare the grandchildren.
Well, I do wear a hat on a sunny day like this. Does you think that makes any difference? I mean, is it a... I mean, it's
I don't think it makes any difference to those, but it's good advice generally, isn't it, when you haven't got much hair up top. So if you go and book that with Kay in the treatment room, let's give it a week after you've had the pictures taken and then phone me and discuss what they've said about it.
OK, yeah, that's fine.
OK?
Yes, thank you.
Super. Cheers then. Bye then.
Hi, how are you doing?
Yeah, I'm all right.
Good.
So it was just because I'm thinking might try for another baby some point in a few months later in the year, and wanting to come off the sertraline and just kind of make a plan for that. So,
yeah, OK. How's everything been going from that side of things?
Yeah, good. I mean, I think I'm just a bit of an anxious person, but yeah.
Well, that's all right, but actually things have been quite calm and settled in the last little while?
Well, we both changed job and moved house.
Right, so with
in January and
all
February,
things considered, because that's a
yeah,
stressful time, isn't it, if you do all of that stuff?
but we've just had a holiday. And,
Yeah. I mean, you're looking very well for it, you know. So
thank you.
And you're thinking about another baby, so that's exciting.
Yeah, not immediately.
Have you done any reading about sertraline and the risks of being pregnant with it? Or?
No, I just presumed I would come off it.
Yeah, I mean, generally that's the right thing to do. There are some risks of, rare risks of the baby not forming properly if you conceive on sertraline, although that's a rare thing. And of course, if people are so ill that with the mental illnesses, you know, anxiety or depression, that they need the pills, then the risk would be greater to stop them rather than to conceive on and off them. So it's a bit of a balance, is I suppose what I'm saying. And I think for you, if everything's going really well, then this is an ideal opportunity for us to think about cutting it down, because actually, anyway, if you're going to have a baby or not, we should be cutting it if you don't need it, isn't it? So, do you think that you're going to be all right on cutting down? Do you have any worries about that?
No, I think a bit of a wait and see.
Yeah.
The only thing is I've missed a couple of days here and there, and I felt a bit off, queasy, like more physically.
Okay,
but then I figure we'll do it slowly.
Sure, and I think that would be the main thing to say about coming off it, is that people do really notice when they come off them. And that's fine. It's common and normal to get some side effects as you reduce, but it just means that we need to do it really slowly.
Yes.
And so sort of over 4 weeks as a minimum, and sometimes even stretch it out even longer. And what you can do is either just miss out a dose and then take one the next day, or you can just take half a tablet as a way of reducing. Does that sound okay?
Yeah, that's
Do you need any more today?
I've got
to get you through
box, I think.
Okay.
So.
Because that one box is a month, and so actually that will give you plenty of tablets then to be able to do that.
Yeah.
Does that sound like a reasonable step for
that's
that?
absolutely fine.
I probably don't need to see you again unless there's any problems.
No, I'll make an appointment if I need to.
Great.
Yeah,
I think that's the thing.
fine.
Or if it gets really bad, just give me a ring.
Yeah.
Or just go back to the dose that you were feeling fine on, because actually then you can just cut it down even more slowly.
Okay.
All right?
Thank you.
Good luck. Fingers crossed. And
Thanks.
I look forward to seeing you as and when.
Right, take care.
Bye then. Nice to see you.
Come on in, have a seat. I'm Dr. Graham.
I've got an existing injury. I had a spinal injury in 2008. And I have a weak arm.
Yeah.
But today, all day, I've had really bad pins and needles, and I felt really tight and uncomfortable, and it's just making me feel really anxious with it, which is probably not helping.
Yeah. What was the injury that you had?
C5-6.
Right.
So I've had an operation. I've had nuts and bolts in there. So now and again I will wake up with pins and needles, and when I'm working it too hard I get pins and needles.
Right.
But it's been constant today, and it's been really nagging.
Yeah.
And it just doesn't feel right.
Yeah. And what do you think might be going on?
Part of me thinks maybe a trapped nerve or something. I've been feeling it in my leg a bit.
Right.
I'm not in screaming agony.
Yeah.
It's all numbness. I was struggling to hold a pen. You know, I could hold it, but not for long.
Yeah. And when you had
the surgery before.
Yeah.
Had you had an accident that caused that, or was it?
Yeah, I fell onto my head.
Right.
So I crushed the nerve and it crushed between the discs. So the discs have come out. I was paralysed neck down.
How are you, Mrs. Smith?
OK, thanks. Not too bad.
Good. It's nice to see you smiling.
Shall I take my coat off, you don't mind?
Yes, no, that's not a problem. Do you want to pop it behind the chair? Is that OK? Or you can hang it up on the other...
John?
You're not wearing your designer coat then today? Don't care about that one. OK. You gave me a book last time.
Yes.
On meditation and mindfulness. And I'm symbolically giving that back to you.
You were very gentle.
That implies that if you've experienced differently before... Your blood pressure's been quite steady.
And I've got no worries, my darling, thanks to you.
Well, it's a bit up this morning, actually. Blood pressure. Carl Hazard, please. What's on your mind this morning?
Right, I've got a history of osteomyelitis in my right ankle.
Mm-hmm.
A couple of days ago, I had a bit of a temperature and quite a bad headache. And I woke up this morning and I've got real bad pain on the inside of my right leg and sort of from the groin to the knee.
OK. You've got a history of spina bifida and you've got this problem with the right foot.
Yep.
So there's a combination of orthopedics and plastic surgery.
Yep.
Spina bifida is a condition that occurs in utero, in other words, when you're pregnant. It's a problem with the development of the spinal cord and its coverings. It can result in problems with muscle weakness as well as fluid around the brain.
This is quite sore down here as well, where I've got the muscle graft.
OK. And I'm going to just pop you behind the curtain here.
Yep.
I just want to have a listen to your chest and have a look at the leg. So, is it all right to call you Carl?
Yeah, of course it is.
She says, having called you Carl all morning. Oh, there we go. All right. Carl has a significant past history of osteomyelitis. This is a very serious condition whereby you can get an infection in the bone. We also have to bear in mind that Carl has metalwork in his leg, and this is a foreign body. If that gets infected, it can be threatening to the limb in the sense that he could lose that limb. OK, and there's pain in the groin, isn't there?
Yeah.
Does it hurt when I touch?
Yes.
OK. Can you push up against my hands? Good. And on this side? Good. OK. I'll let you get dressed. Take your time.
OK.
Is it stopping you from doing anything?
Not really stopping me doing anything. It's just when I walk, it's just gets a bit painful.
There's no signs of any infection.
OK.
I think it would be a good idea to run a blood test this morning because we'll get the result fairly quickly. It may be worth just reviewing you back next week.
OK.
And sooner if things haven't settled or if they're getting worse.
Yeah, all right.
Because of your past history, we're just extra cautious.
Yeah.
But often these things turn out to be just a muscular something or another in view of your
Hopefully
general orthopaedic history, you know? Things that would check you over.
OK. Thank you very much.
That's not a problem. Take care.
Okay, all right. Thank you very much.
Bye-bye.
Thank you. Bye-bye.
You got that.
Well, you would, being a City fan.
All right, so I think you might be right that the disc may have come out again to a very much smaller degree, and it's pressing on some nerves.
Right.
OK? So you probably know this, but you know you've got your bones in your neck.
Yeah.
All the way down your spine, and in between you've got glue-like stuff, which is called disc, and your nerves come out. Yeah. And a little bit of that has come out and is pressing on the nerve, and it's sending the wrong messages down, so the kind of numbness messages, but also pain. Normally, it goes back in again on its own. Do you see what I mean? Okay. But this time, it's staying out for a bit longer than you're used to.
Right.
Does that make sense?
Yeah.
The question is what we do next, OK?
Yeah.
Yeah. So the first thing is to think about some pain relief. And the second thing is to think about whether we want to just give it a few days and see if it just gets better on its own, okay? And if it doesn't, then we'll probably do another head scan to see what's happening.
Would that be like an MRI?
Yes. But I'm not saying you need that yet. You know, we know...
I'm reassured that it's something connected with what I've already...
I think it's most likely to be exactly the same as what you had before. Obviously not the whole neck down, okay?
Yeah.
No, painkiller-wise...
I'm not in a massive amount of pain.
OK. So the kinds of things that would worry me and make me think we need to see you sooner would be if you were to get any problems with your bowels or your bladder, you know, losing control of either of them, you know, because that is a worry because it's affecting the nerves that control your bowel and bladder, and that is an emergency, really.
OK.
OK?
Thank you for the reassurance.
OK,
good. Much appreciated.
That's
Lovely.
all right.
Thank you. I'll go and carry on.
OK, bye now.
Cheers, bye-bye.
Cameron? OK, Hyman. Right, let's just bring up a chair. Do you want to sit in that one and Mummy can sit in that one?
Because this is for you, not me.
This is for you. This is something to do with his ears, I gather. Is that right? Yeah. Just fill me in.
He had a perforated eardrum.
This is when he saw Lizzie Harris recently.
Yes,
yes. Okay. And how's he been since then?
Good, really good. We just want to make sure, because he's not been swimming for a while and he normally does that on Tuesday.
The ear was discharging, is that right? Yep. Has it stopped discharging now? How's his hearing, do you think?
Good. Back to normal, I think.
Is it?
Yeah.
OK. Well, that all sounds good. All right. OK, let's have a look. So it was the right ear that was the bad one, wasn't it? And the left ear, Lizzie said, was normal? Yeah. OK. Can I look in your left ear first? Can I look at that one, your good one first? Good luck. OK. All right, so that is a normal ear canal, normal eardrum, no holes or anything. We wouldn't expect it. If I press there, does it hurt?
No.
If I press there, does it hurt?
No.
Good. Very sure about that. OK, I'm just going to take slightly longer over this one. No, everything looks intact, actually. The eardrum is marvellous at healing itself in the majority of cases. So it looks normal, OK? There's definitely no hole in that.
Oh, wow.
A nice sort of shiny eardrum and no inflammation or anything. So, yeah, you can go back to swimming.
Yay.
Yeah. And I'm surprised you say that his hearing's completely back to normal, because it often takes a little bit longer than this, but... Well, if it is, it is. So that's great. So, yeah, no restrictions, really.
Lovely.
OK. All right. That's quick, wasn't it?
Yeah.
Good. OK.
Thank you.
Cheerio, then.
Thank you.
All right, well done, holding the door open for Mum. It's like a trap, isn't it? It's like an assault course. OK, cheerio then. Bye-bye. Bye, Cameron.
All done.
Bye-bye now.
Bye. Bye-bye, boys. Say bye.